Hello, I'm Jeff Albright, and I will be discussing my time in my second rotation at Palmetto Subacute Care Center. So, question one: what populations and type of agency are you interning during the Summer B session? Where is it located? Provide a brief background. The population I am working with is the geriatric population. The agency is Palmetto Subacute Care Center. It is located in sunny South Florida. The address is 7600 Southwest 8th Street, Miami, Florida 33144. Just a few minutes from Florida International University, Modesto Modique campus. The background is services provided by Palmetto Subacute Care Center, according to their website, is services provided. Palmetto Subacute Care Center is a 95-bed skilled nursing and rehabilitative facility that delivers superior medical care and attention to patients with post-acute and chronic illness. When looking at the various departments for meeting each of the patient's needs are skilled nursing care, rehabilitation services, care management, dietary services, recreation activities, and then to further break it down, in the skilled nursing care, it's infusion therapy, advanced wound care, enteral feedings, pain management, in-house consultations with physician specialists, restorative nursing care 7 days a week. In the rehabilitation services, you have physical therapy, occupational therapy, and speech pathology, individualized therapy, orthopedic recovery, stroke rehabilitation, vital stem therapy, which is FDA approved, and modified barium swallow studies. For case management, you have social services director certified in mental health counseling, assist with community discharge planning, and psychological services. In the dietary services, you have registered dietitians, assessment and management of individualized nutrition programs, and delicious, well-balanced meals featuring Latin cuisine. Recreational activities include daily social activities with special holiday events, therapeutic recreational activities, pet therapy, and provider for Medicare Advantage plans and HMOs, as well as university and hospital affiliations for clinical internships. This location is rated a 5-star nursing home according to the U.S. News in 2016 to 2017. Question 2. What has been your biggest struggle with that specific population thus far, and how have you overcome such challenges? Well, let me tell you. My biggest struggle has been the communication barrier between patients and certain staff. Most of the patients are Cuban or other Hispanic descent and only speak in Spanish. When trying to resolve or calm a situation down, effective communication is paramount. My bilingual skill sets in Spanish has slowly progressed. I did utilize those team members around me to sometimes help in complex dialogue for me that is outside my norm of hola, hello, comida, food, and yo ayudad, I help. Sometimes it would become frustrating for the patient when we had to wait for a translator. I am continually learning, adapting, and proceeding to carry out my service to the staff and patients with various and sometimes new situations that arise. I also relied on effective communication from my superiors, my supervisor, and others. What was the most effective, this is question 3, and what was the most effective recreational therapy, therapeutic recreation, activity facilitation technique used with a particular population of patients you have worked with at the site, and why? What was the most challenging activity facilitation technique, and why? The most effective recreational therapy, therapeutic recreation, activity facilitation technique used with the vast majority of geriatric Cuban population and geriatrics in general is a sensory diet consisting of music therapy and visual stimulation of music with video, in combination with tactile stimuli of instruments. During this time, instruments were handed out to patients with the capable, gross and fine motor skills necessary to use such instruments. The instruments used were percussion instruments, such as the maracas, wood sticks, wood block, tambourine, small drums, cowbell, and cymbals. This seemed to be the most engaging for the group as a whole. The rhythm, sounds, sights, and the creativity of making music while contributing to a social setting while others are doing the same thing, I believe is an intrinsic value that dates back to the earliest humankind. Music, percussion mostly, can be found in various cultures across time and space. History shows music as being intrinsically weaved in our very fibers of society from past to present. I have observed those patients with little movement, communication, or other forms of activity all of a sudden come to life when music is heard. Those who might not have strong motor skills are slightly moving to the music or singing along as well. Those who only speak English still participate in Spanish songs and have a smile upon their face, such as the rest of the group does as well. The most challenging activity when I first started with the geriatric population in Rotation 2 at Palmetto was bingo. I did not know my numbers very well in Spanish past 10. I quickly learned to say numbers up to 75. I also learned how to call various games of bingo, such as Four Corners, Cuatro Esquinas, or regular bingo, bingo regular, and total card, tarjeta total. We played one game of Four Corners, 2 games of regular bingo, and to end, 1 game of total card. The patients worked with me and helped me with my pronunciation as best they could. It was challenging, but satisfying when I said a word, letter, or number right, and they cheered for me. Question 4. At your internship, what would you say is the single greatest moment you have had with a client? My single greatest moment I had with a client. Wow. There were a lot of good moments. The one that sticks out the most to me is when I had this one gentleman that was a boxer in his earlier days of life. We connected instantly despite the communication barrier of Spanish-English. He was always happy to see me. I spoke to him sometimes with just body language and he understood. The little Spanish I knew, he also understood, and when we spoke, I understood him. When we talked about family, places we've been, where we came from, our respective sports, side note, I'm a swimmer, and also the love we had for food. There were a few times I saw he would be frustrated with my group activity, so I would pull him to the side and work with him on a one-to-one. He one day offered me his fresh Jell-O cup. A Jell-O cup I have seen him enjoy eating before. I thanked him, but I told him I could get one, and that he should enjoy it. We enjoyed each other's company, but he knew when it was time for me to help others and gave me a nod of approval. I had a connection with the other patients, but his was of kindred spirit. I don't know why, it just was. Question 5. What do you feel is your supervisor's greatest strength as a therapist? Explain why. Amy Pizarro possesses her leadership abilities. That is, I feel, her strongest strength. She was effective through communication, leading by example, as well as her compassion for her patients and staff. As a leader, she was very organized with time and activities, knowing when to delegate or doing something herself. Question 6. What do you feel is your greatest strength as a future therapist? Explain why. I feel my own leadership abilities will help me as a future therapist. Everything that encompasses a leader, as mentioned by my supervisor's greatest strength. I want to be leading a care team staff as a therapist after I establish myself with experience in my career path. I also would like to go on to become a doctorate in physical therapy, and I feel these skill sets will definitely help. What I am learning now from my mentors, professors, supervisors in therapy, and my parents will help me accomplish my goal in becoming an effective therapist for others. thank you very much, and I appreciate you for taking the time to listen and learn. Thank you.